Another area where this comes up, sometimes if the pain was in their mind caused by a particular event, there might be a lot of anger towards a particular individual that they perceive as having caused it. For example, I've heard people say, oh, my mom made me sleep in a really uncomfortable bed growing up. It's all her fault. I'm so angry at her that she caused this pain. My life is forever ruined because of her. And so sometimes it's just trying to uncover, some of those resentments that they might be holding, let's say, from perhaps a perpetrator, perhaps whoever they feel like was, parent who was neglectful or something like that.
Hi. So today I'm doing something a little different. So I'm going to interview a colleague, Dr. Liz Ross, and we're going to talk about chronic pain and narcissism. And I think it's really great that we're able to tap into other psychologists and their expertise like Dr. Ross, who is very experienced and very skilled at working with chronic pain and all types of individuals, particularly those that fall along the narcissistic spectrum. And let's get to meet Dr. Ross. Hey, Dr. Ross.
Hey, thanks so much for having me.
Yeah, you're welcome. You're welcome. So tell us a little bit about your practice, and then we'll dive in to chronic pain and narcissism.
Sure. So my name is Dr. Liz Ross. I'm a clinical psychologist, and I own a group practice called the Coping Resource Center. And so just as a little background, prior to the transition to private practice, I was working in the hospital system. So I spent a lot of time at TR Memorial Hermann working on spinal cord injury. I spent some time at MD Anderson, Baylor Pain Clinic. I was also part-time at a substance abuse rehabilitation center for a while. So I have a lot of expertise in training and working with this population.
That is amazing. And in all of your experience, have you encountered folks that are along the narcissistic spectrum, and what have been some of your challenges?
Yeah, so thanks so much for asking. Yes, I've certainly, in all those settings, worked with folks who would qualify as being on the narcissistic spectrum. I think we talked about this previously, but, sometimes narcissists tend to be attracted to some of the brand name sort of hospital systems or universities, things like that. So anytime you're in one of those settings where, perhaps it's on national ranking or it's a recognizable name, you might attract sort of more of those types of clients, more of those types of patients.
Yeah. Some of the folks that are there more for the name than, let's say, and this is, we're not saying anything bad about those places, but they may miss the component that they're able to tap into more of the personality-related aspects, or even the chronic pain as it sort of intersects with the personality and chronic pain aspect.
Right. And sometimes what you'll find is, particularly with kind of like well-resourced individuals who might be along the spectrum, right? They probably have very high expectations, right, of what they're getting out of treatment. So again, going to sort of the best places, or, they might want to work with certain individuals with certain titles or certain degrees, right? But also their expectations might be that there's sort of a quick and easy fix to their problems, right? I used to joke that no one says, I want my healing process to be longer, right? Everyone.
right. No one ever says that.
No one ever says that, right?
They don't.
Right. Yeah, when I was working on spinal cord injury, no one said, oh, I wish it would take longer for me to start walking again or something like that, right?
Oh,
Everyone wants to be fixed yesterday.
Sure.
Right? And that can be perhaps a bit amplified when you're working with somebody with, let's say, narcissistic personality disorder.
Oh, for sure.
Particularly if they are well-resourced and perhaps used to being able to use their connections or throw money at a problem and find a quick solution.
Right. Absolutely. And I think, you mentioned those high resource individuals, and I think there's such a spectrum as to the types of resources that people can ask. When we talk about high resource individuals, that these individuals obviously, typically we're talking about money and the ability or perhaps freedom in their schedule, so on and so forth. But I think that there's such a broad range of that. So, and you working in so many different areas and domains. So, what are some of the things that you have found even across those various resources?
Right.
So when you start working with someone and they have a chronic pain issue, and you start to to get that, I call it like a sniffer, you start to kind of smell some narcissism, or issues like that. How do you adjust how you work with them or your approach or your scope?
Right. Yeah, that's a really good question. So I think what's always important up front when I'm working with a patient with chronic pain or disability medical issues is to just be really clear about expectations and not promise somebody that you're going to cure them or fix them or they're no longer going to experience this problem anymore, right?
Oh, yeah.
So the idea is that, you're teaching them strategies to learn how to manage it, right? And learn how to perhaps be able to still live a full, fulfilling life, even in the face of something like chronic pain or disability or something like that.
Definitely.
Yeah.
Definitely. Yeah, and those expectations. So when we talk about somebody along the narcissistic spectrum, we know that gets amplified.
Right.
So that's where those maladaptive patterns come in, that expectation that it gets externalized. So that you are the one that is supposed to bring them to a sense of wellness, or you're supposed to completely, remove the chronic pain and the narcissism. So in those situations, how do you manage that? Like how have you dealt with that?
Good question. So, I think, again, just being very, very clear about what the expected outcomes could be. A lot of the strategies I use are really, to be used outside of the session, right? So we might go over something in the session. For example, one that I probably go over with almost every chronic pain patient is the idea of activity pacing. And so normally when somebody has pain, which makes logical sense, they will engage in activity until it's too painful and then stop, right? It makes sense.
Yeah.
But what we know is once we get kind of over that hump of too much pain, it's much harder to manage. And so if you're able to convince somebody that if they were to stop an activity at a designated time before their pain gets too bad, right, and decide to insert some breaks in there, they can usually manage their pain much better and engage in that activity actually for a longer period of time, right? So one of the challenges often with working with this population is the expectation that things are going to happen, the healing is going to happen in session, or things that are going to happen in session. So you just have to be really clear that, no, actually I'm teaching you strategies so that you can use them in your everyday life.
Mm-hmm. Mm-hmm. And I mean, we could even use an analogy, and tell me if this fits, but like you could think of like Kung Fu, right? So with Kung Fu, right? So you go to the dojo and you learn those skills, but the idea isn't to only use those skills at the dojo. The idea is to then use it out in the world for self-protection or wellness or whatever it is. And so it sounds like you use a similar model, just no dojo, which is okay. Yeah.
I wish I had more dojo in my life.
Hey, geez, boy, I hear that. I hear that for sure, for sure. But so when you talk about that pain level, do you notice that maybe some maladaptive strategies come out or some defense mechanisms due to expectations that narcissistic individuals have? Oftentimes they're distorted or they're skewed, which most individuals, as we know, with personality disorders tend to have a distorted view of self, other, the world around them. Absolutely, chronic pain makes that worse. Right. So do you see that's when various defense mechanisms kind of kick in, or you get more resistance because the expectation is just that they're going to leave your office and chronic pain will go from, let's say, a 9 on a scale from 1 to 10, and then it'll be a 7 when they leave your office. It'll stay a 7. So do you see that there's some defense mechanisms that come into play, and how do you see them, and how do you manage them?
Yeah. So interesting question. And so I'm first going to sort of go to an interesting research study, which if you're familiar with the chronic pain research, so one way they measure pain and pain perception is actually to have people dunk their hand in really cold water. Okay.
Oh, okay.
So
yeah, that's cool. I didn't know this.
Right,
Okay,
right.
This is why Dr. Ross is here. Yeah. Okay.
So I know the ice plunges are very in vogue right now, and I can't get myself to do it probably because I associate it with pain like most of us do, right?
Sure, there you go.
Yeah. So they study people's personality traits, have them dunk their hand in water, and then measure their pain levels and reactions. And so they're actually reporting around the same amount of pain, but their reaction to the pain is different. Okay, so they're having more sort of grimaces, like negative facial affect. Their reporting of their reaction to the pain is worse. So even though they have the same experience, they're reporting that it feels worse to them. And it could be because, sort of going back to this idea of expectations, perhaps there's more of an expectation that, they should not experience pain, or they should not experience discomfort, or should not have to experience these negative things that, all of us experience from time to time.
Wow. Yeah. Wow. That's really fascinating. That's really cool. And we go to a component, and you and I talked about, using CBT with complex cases and things of that nature. And I noticed that you mentioned the shoulds, right? And about, how, for me, for my clients, sometimes I'll use some CBT aspects, and a lot of times it relates to, that we shouldn't be shoulding on ourselves, right?
Right.
And so, and do you use a similar approach, or is it different when you have chronic pain and certainly narcissistic spectrum clients that you're working with?
Right. So there is something called pain catastrophizing, which we often measure when we're working with chronic pain patients. And so, again, it's not just the pain experience itself, but it's sort of the reaction to the pain, right? When people have really extreme thoughts related to their pain, this is never going to end, this is the worst thing I've ever experienced, my life is never going to be the same, which can be normal for anyone who's experiencing chronic pain, but a lot of times those are more exacerbated for someone who has narcissistic traits, for example. Okay. And that's something we often target in therapy. So trying to get those thoughts to be a bit more balanced and not just focusing so much on the negative aspects of your life, but having sort of a more neutral or hopeful sort of perception or viewpoint on it.
And I think that's really cool, because it really broadens my conceptualization of certainly, what I know about chronic pain, which, I mean, compared to your expertise, tends to be very small. But also looking at sort of that core content. So, when I work with individuals with personality disorders, I always try to get to that core content. And that classic core content, which I've talked about in a lot of other videos as well, which is that typically for narcissists, it's fear, shame, doubt, inferiority, and guilt. And do you see any of those components? I mean, they manifest differently.
Right.
But do you see any of those components, perhaps, that when you're talking about pain levels, or you're talking about distortions of, should that person feel any pain? Like sometimes, that grandiose narcissist that is like, well, I have this, but I shouldn't be feeling this type of pain.
Right.
So, and I know that I've just put a whole bunch of stuff together. So however you want to tease it up, we're all here. Yeah. We're all picking your brain.
Exactly. Yeah. And so, for example, for a grandiose narcissist, right, they might have those expectations like, my life should go well all the time. I shouldn't experience pain. Maybe the pain even kind of reminds them of other things that they might not want to think about, like aging or deterioration, right? Things like that. They might be fearful that others will perceive them negatively or as weak or in a pejorative way. And so for those folks, they might actually be more prone to trying to hide pain and maybe any disability that's associated with the pain. So for example, if their gait is affected or something like that, right? Or they're not able to sit comfortably in a chair or something like that. They might try to avoid a lot of situations where that might be apparent to others.
Yeah. And in those situations, do you think that narcissist, because of that tendency to externalize a lot of those issues, so if they're in that situation, like let's say it's a happy hour, right? And they have trouble sitting down or something like that. So do you think, would they externalize that and blame others about why they don't feel as well or things like that? And have you encountered actual patients and clients who have had similar scenarios like that?
Absolutely. So so that could come up in a treatment setting, certainly, where there's the expectations that everyone else is aware of what might amplify their pain, and they might, expect others to account for that even before they've entered the space or entered the area, right? Or, they might be upset, for example, if you're set up in your office, if they feel like it's not appropriate for, their own specific pain or their own disability, and might even accuse you of, not being someone who's an expert in the area or not being knowledgeable in the area because you don't have the correct setup for them.
Yep.
Another area where this comes up, sometimes if the pain was in their mind caused by a particular event, there might be a lot of anger towards a particular individual that they perceive as having caused it. For example, I've heard people say, oh, my mom made me sleep in a really uncomfortable bed growing up. It's all her fault. I'm so angry at her that she caused this pain. My life is forever ruined because of her. Right?
Oh, definitely. Oh, wow. So in those types of scenarios, so with a client, so not only then are you dealing with the chronic pain aspect, but now you're dealing with certainly, lifetime aspects, whether, and I would imagine, so when we talk about trauma, individuals with trauma and narcissism and chronic pain, I mean, in some ways, I guess in my head, what I want to say is that the perfect storm of just really a complex, challenging client, and how have you dealt with that, or what is your approach to that, something that complex?
Yeah, I would say that comes up pretty frequently, right? Yeah. And actually, there's some evidence to suggest that, someone who has experienced trauma is more likely to have medical issues, is more likely to have chronic pain, for a number of reasons. So that presentation can come up pretty frequently. And so sometimes it's just trying to uncover, some of those resentments that they might be holding, let's say, from perhaps a perpetrator, perhaps whoever they feel like was, parent who was neglectful or something like that, right? That person might become like the target of their negative feelings about what's going on with them physically.
Wow. And then, so could you mentioned some strategies and techniques that you use. So I'm gonna lightly put you on the spot. So in that type of scenario, so because to me that, as somebody who doesn't work with chronic pain but works with personality, like that would be just an extra layer of complication. So where would you go first? Like I know where I would go. But I'm not going to tell you until after we get your answer.
Oh man, tell me the answer.
I know, right? But I'm not gonna. But so where would you go first, or are there various client-specific aspects in which you would use various strategies?
Yeah, good question. I mean, I think you always have to individualize treatment based on the presentation, right? If someone's got that much going on, I like to give them some distress tolerance skills before we start diving into something like trauma, PTSD, if it's there, right? Early childhood parenting type of issues. But like you said, it's complex and complicated, and you might have to adjust sort of your treatment plan and treatment strategies sort of as you dig in.
Yeah, and this is probably, this is also why it's so important, to talk to somebody with your level of expertise. Because in my head, I'm thinking, okay, because that chronic pain is going to be, lack of a better word, and I'm probably not using a good word, but debilitating, right, to varying degrees. But because of the debilitation that I associate with chronic pain, so you wouldn't go to chronic pain first. You would very much individualize the approach based upon like the interference of what different aspects are in their life, whether it's a relationship aspect, whether it's familial or romantic or friendship or work related, things like that. So so you don't always go to chronic pain first. Is that?
It just depends. Yeah. I'll usually give them a few strategies there at least, but part of my approach is talking about how all those things are really interrelated, right? So let's just give a really light example, right? Let's just say that you are sick or have an illness, or, you stubbed your toe or something like that, right? If later that day you're in a stressful situation or you have a difficult conversation, those pain signals are going to be amplified. So you're actually going to feel sicker, feel worse, right? All of a sudden your head's hurting, right?
Yeah.
Because you're in a fight with your spouse or whatever else is going on that day, right? Or you've got a work deadline. So the psychological and physical are really interconnected. And so one way of addressing the pain is actually also addressing the psychological components that are going on. So, for example, and it's bidirectional, right? If any of us experience chronic pain, as you can imagine, it puts you at increased risk for depression, anxiety, all of those things, right? So I don't want to say that it's all in your head or anything like that, right? But those things can influence and impact each other. So any area where you can intervene, that can also be helpful in terms of managing their pain, you want to do that. So you don't just, you've got to address any other sort of social stressors or psychological stressors that are going on in their life as well.
Okay. Yeah, I mean, there's so many levels, which again, I think is why, when we were talking about doing this video, because, I mean, even myself, doing this for a long time, these are just facets which is why it's so good to have you here, because it's so good to tap into your expertise. And so I wonder, what would you recommend as far as like family members or loved ones or even friends, because you mentioned earlier about expectations that the individual along the narcissistic spectrum may have based upon various situations that they're in, that they would have these expectations that, oh, my girlfriend, spouse, husband, whomever it may be, well, they should manage the environment so I'm more comfortable. Right? So if you were talking to those partners or those family members or those friends or coworkers, what are there certain like go-to recommendations? And I'm not trying to put you on the spot, but some go-to recommendations, or what kind of recommendations would you make to them to manage the situation best? Yeah. I may not have phrased it great, but I'm doing my best.
Yeah, no, you phrased it just great. So, yeah. So what I would say is, one thing we haven't talked about, a few things we haven't talked about is that because people, sometimes people on the narcissistic spectrum tend to be a bit more prone to substance use disorders. And so I think one thing you would want to kind of look out for is, of course, like medication overuse and things like that. I think that's something for family members to just be aware of. And I don't want to stigmatize anyone using medications for pain. That's very common and normal, and everyone's individual, and so everyone's situation is very different in terms of how that's managed. But just looking out for things like that. If you've got someone, for example, who's more of, a vulnerable narcissist where, they might have a belief system that no one understands their pain, or their pain is very special and unique and can't be treated and things like that. I think one thing you'd sort of look out for is just like enabling behaviors. So trying to get that person to take a little bit more agency, right, in their own management of the pain, right? And, I don't want to say don't be validating or don't be accommodating, but just making sure that you're not being overly accommodating in some situations.
So what I hear saying is that, so the loved one, family member, friend, whomever it may be, don't do things that you believe the person can do themselves, right?
Right.
So when we talk about like agency, so what are tips or suggestions as to how that identified other, friend, partner, family member, how can they go about sort of working to define those enabling as opposed to helpful strategies? How would you define that? Is that?
Yeah, that's a good question. And I also just want to back up and say, I don't want anyone to encourage anyone to invalidate somebody's experience, right? It's okay to use validating language and things like that, and use empathy. I think there's a difference between being empathetic and then over-functioning, right? And so where are those family members able to set those boundaries with their loved ones, right? What do they, and I think some of that comes from where does that family member or spouse or the child or whoever it is, what do they feel comfortable with, right? Like where would they draw their own lines in terms of caretaking and things like that, right? And feeling more empowered to be able to set those boundaries.
And when we talk about, that if that identified, lack of a way to put it, the identified patient, let's say, right, has chronic pain, also narcissism, And then you have those relationship dynamics, which is certainly, high expectations, shouldn't have any pain, things like that. So, I mean, I think so about approaching that and kind of, how can we address the issue of how can I be most helpful, but having the individual with narcissism be receptive to it. Like I always think, that so we strike when the iron's cold, which is that not in the heat of
Right.
if you would call it this, like a chronic pain flare-up, whatever it may be, or if they're in the mix of pain, or they're in the mix of a depressive episode or anxiety episode. Now, this is my conceptualization, and so tell me if I'm wrong. I was wrong once in 8th grade, so it's very possible I could be wrong again.
I don't
here.
believe you're wrong in 8th grade.
Oh, man,
yeah.
that's the best one. Thank you so much. That's so nice. But so about what, how to approach that when all is calm and say, hey, let's kind of talk about the best way for me to help you.
Mm-hmm.
Or are there particular approaches that you would utilize? You recommend that striking when the iron's cold? Or are there other approaches that you might recommend for a loved one, family member, identified other?
Right. I think striking when the iron's cold is always a good approach, because when somebody's really elevated for a number of reasons, like if their physical pain flare up, like you're saying, or emotionally elevated, typically they're probably going to be less receptive to whatever it is you're trying to say or whatever boundaries you're trying to set with them, right? And so I think the other side of that is you don't necessarily want to reinforce, let's just use the word like a tantrum or something like that, right? Mm-hmm. So you don't want someone to think, I only get what I want when I am really amplified, right? And so I think there's sort of like a balance there with, again, trying to help kind of help someone through a flare-up or help contain them through a flare-up, and also being able to have a more measured conversation during a calmer period of time.
Okay. Yeah. Wow. Yeah. Okay. That's so cool. It's not cool but it's cool like your approach, because, we both certainly work in psychology and we deal with people with personality disorders and a wide variety of issues, as well as chronic pain on your end, and that our approach is so different. And in your experience, and this will be my last question, because I don't want to take up your whole day. I could.
That's okay. Well, I was going to say, I'd like to also hear more about your approach if we have time.
Oh, yeah, sure. So my approach if someone with chronic pain and narcissism, I think that the way that I would conceptualize it, if I can't get them in to see you, then I think that what I would do is I would certainly try to consult with you as much as possible. And I think that when we find experts in various areas, I think it's so important for us to be able to reach out and tap into people like yourself that are experts in particular areas. I mean, people have tapped me as far as like personality disorders and things like that. And I think that I would try to get some strategies that would be most helpful, including that aspect of chronic pain. But I think that from knowing you and having conversations and today is having this, that chronic pain shouldn't be the go-to. That look at obviously the whole individual and what aspects are most impairing their adaptive functioning. Is it the narcissism? Is it the relational component? Is it the chronic pain? And how are each of those various domains being managed? Are they managed maladaptively, adaptively, and to what degree? So that would be my first approach. And then I would look at that chronic pain and how is it impacting the narcissism. Just exactly as you mentioned, individuals along the narcissistic spectrum are absolutely going to have that perspective that I shouldn't feel pain, right? Mm-hmm. That was the plunge there. I'm never going to forget the plunge. I'm never going to forget that. Right, that I shouldn't be feeling pain, that I shouldn't be uncomfortable. And in those situations that everybody should just know, right? I mean, individuals along the narcissistic spectrum are typically very poor communicators, typically. That doesn't mean not, that all are, and we know that it's on a spectrum. But they're typically poor communicators in that they just have implicit expectations everybody else knows that I have back pain or that I've experienced a stroke or whatever it may be, and my functioning is here, so everyone should accommodate. And I think that certainly plays out in your therapy, very similar as it does with mine. So I think looking at those various aspects, but also teaching them the language in which to communicate that pain while managing the narcissistic flare-ups, right? We talked about chronic pain flare-ups. You can certainly have, narcissistic rage or narcissistic flare-ups as well. So it's keeping that balance in place. And, I to be completely transparent, I think that if in working with someone and working with the narcissism and working on relational components as they relate to the narcissism, I think that if the chronic pain continued to be a detractor from the therapeutic success, I think that there would be at least two options, which I would try to bring someone like yourself into the therapeutic process, where it would be Dr. Ross, myself, and the client, or then just refer to you for the chronic pain, but also giving you all the information as it relates to the narcissism and relational components as well. So I don't know. Would that
Yes.
fit?
Wait, I'm so glad you brought up communication. We haven't mentioned that yet. So I think one thing that all patients with chronic pain struggle with is communication, because for a lot of them, you can't go and look at an X-ray or an MRI and see something. And so it's on them to describe their symptoms to their treating providers, right? And that can feel really invalidating. And I think there's always a concern that they're not going to be believed, or that their treating providers are going to tell them that there's nothing wrong with you, or there's nothing wrong with them, right? Mm-hmm. And so a lot of patients, by the time they come to see me, they've felt really invalidated, or, as the very popular term, gaslit by their medical providers, right? Mm-hmm. And so I think, like you said, for somebody who might be struggling with a personality disorder, communication might be even more difficult. And so you might focus a lot of the treatment on just how to communicate with your family members about what's going on with you, and how to communicate with your treatment providers, because there might also be the expectation. I think a lot of people have this expectation. You go to a physician, they're the expert, they know everything, right? Right. But in the real world, people are really medically complicated, and a lot of things are unknown or untreatable, or don't have a specific diagnosis. And so it's really on the individual to kind of be the quarterback of their own care. And so just teaching somebody how to advocate for themselves in an assertive, right, way, rather than an aggressive way, or rather than like a more indirect or passive way, right, is often a major target of the treatment.
And is that something that you've done with a lot of your clients and your patients, on how to communicate their pain to their doctor?
Yes. So because again, I think we've all had the experience growing up, perhaps, where you go to the doctor, maybe you have something very straightforward, right? You describe a few symptoms, perhaps they prescribe you a Z-Pak and you're good to go, right? Yeah. And so that's what a lot of our expectations of the medical system are. But let's say you get a diagnosis like fibromyalgia, right, where there's not a clear, sometimes there's not a clear reason why somebody might develop those symptoms, and sometimes there's not a clear prognosis or a treatment plan for those symptoms, right? And so it's really on the patient themselves, and sometimes their family members, to advocate and to try to find, proper treatment, and also try to figure out, okay, how much of this is treatable, and how much of this am I going to have to learn how to just manage on my own?
Absolutely. I mean, I'm just thinking like that's so important, because you have to speak the doctor, the physician's language, in order for them to understand what you're saying. And if you're caught in sort of the whirlpool, so to speak, or tidal wave of chronic pain, it can make it harder to communicate that, especially if you've gone to several providers. Right. And now you're starting to get frustrated, and you start to get this sense that, well, nobody believes me. Right. And that can sometimes mimic past experiences, right? It can, it's a recapitulation of past experience. So you end up with just feeling like, oh, this person's just like everybody else, just like everybody else. And really, it sounds like what you're saying is, so with working with, experts like yourself, that you can really learn the skills in order to increase the probability, because there's no guarantee, but you increase the probability of that physician, of that medical provider hearing you.
Right.
And that can sometimes maybe clear out some of the distortion, because just like people with, and we're not saying all physicians have narcissism or anything like that, but it's sometimes doctors have a degree of distortion when they're dealing with chronic pain, because it's not always something as direct as, let's say, a stroke or a traumatic brain injury or spinal cord issues. Sometimes it's something like fibromyalgia, where you don't have that identified component. And so if we were going to finish today's talk, what is something that you would want people to take away from our discussion here? And then we'll talk about how to find you and find your practice and learn more about you.
Okay. So I think some takeaways have been that oftentimes a presentation is really complicated, right? And you've got to kind of individualize the treatment according to what's going on. And oftentimes these issues don't happen in a vacuum, right? There's a lot of other things that are going on in the person's life, right? And like you're saying, sometimes even the experience of chronic pain and having to go to different medical providers or talk to family members and feeling invalidated can kind of reactivate some of maybe their traumas from earlier in life, right? Maybe they felt like, oh, mom and dad didn't listen to me or didn't believe me, and now, I'm going to this doctor, they're also treating me the same way. And so I think with each person, you really have to look at the entire person and what's going on, all of the factors in their life, to be able to successfully treat someone.
That is so great. So how can people learn more about you? I'll put the link to your practice in the description. And is that the best way for people to find you? Are there other resources?
Yes. So my practice is called the Coping Resource Center. Our website is copingresourcecenter.com. We have an Instagram account. We've kept it very simple, at Coping Resource Center. Those are the best ways to reach us.
Okay. And you have a number of other providers who work with you as well.
That's right.
Okay.
So we've got, it's 3 psychologists as of now. We're all PsyPAC certified, so we can cross state lines. And we've got 2 trainees. We're about to add another one and continuing to grow.
Okay. Well, that is wonderful. Thank you so much, Dr. Liz Ross. And I know you're super busy, so I really appreciate it. And please leave any comments. I will be sure to put a link to a video here that you might find helpful as well, as to learn more about managing and working with individuals with narcissistic personality disorder. So thanks a lot, and I'll see you next time.
Thank you for having me.